Hi, my name's Cody. I'll be presenting on the financial analysis of outpatient evaluation and management billing, comparing IR to other specialties. I have no disclosures. So the purpose of this is as IR grows to become a more clinically oriented specialty, it's important that we understand the data behind our clinical growth and also the codes that we're billing for as we grow into this new space. Increasingly, in the face of declining procedural reimbursement, this becomes even more important. So the aim is to analyze trends in both submitted charges and reimbursement by aggregate and individually by specialty as well. For methods, we use data from the Medicare Part B physician supplier procedure summary master files, stratified by both CPT code and by specialty. So this is a sample of some of the CPT codes we looked at for new outpatient encounters and the requirements to bill for each of them. And then here is the same thing, but for established outpatient encounters. So here's a summary of the reimbursement for outpatient encounters, both new and established patients across the study time period, and we see an increase for all encounter complexity levels. It's worth noting that the increase for all established outpatients in green over on the right is greater than the increase in any individual complexity level, and this is due to a trend towards more complex encounters over the study time period. And we can see that on the next slide here. As we look at national trends in outpatient complexity billing, this is between all specialties. We see a trend away from low complexity encounters towards high complexity encounters. When we stratify by just interventional radiology, we see a similar trend, but that there's probably more low complexity encounters, and that's confirmed when we compare interventional radiology to other specialties. We can see a higher proportion of low complexity encounters and a lower proportion of high complexity encounters. And this is important because overall reimbursement depends on the number of patients seen, but also the complexity level, since higher complexity levels have higher reimbursement rates. Overall reimbursement rates for Medicare levels are generally fixed with a small variation by geography. And then this translates to a lower reimbursement overall for outpatient encounters, established outpatient encounters in interventional radiology. You can see that we are less than any of these comparative specialties here, but across the board for all specialties, interventional radiology is actually reimbursed the lowest of all specialties for 100 Medicare beneficiaries on average. Looking at our own institutional data, we can see that we bill for a much higher proportion of high complexity encounters. This could be due to practice variation just in different settings, given that we're an academic center, or it could be due to variations between practices in billing habits. So in conclusion, there's increasing reimbursement for outpatient encounters across the board for all specialties at all complexity levels. IR bills for a higher proportion of low complexity encounters compared to other specialties, and it's worth looking more into the cause and implications of these differences.